Imagine waking up one morning to a world where the safety nets that have supported millions of Americans for decades, Medicare and Medicaid, no longer exist. These programs, pillars of the U.S. healthcare system since the 1960s, serve as a lifeline for the elderly, disabled, and low-income individuals. Without them, the healthcare landscape would undergo a seismic shift. The immediate aftermath would not just affect hospitals and insurance companies, it would reverberate across every facet of American life, from individual health outcomes and financial security to the broader economic and social systems. The elimination of these programs would create ripples powerful enough to reshape the country's very identity. At the core of the disruption would be tens of millions of individuals who rely on these services. Medicare currently covers over 65 million Americans, primarily those aged 65 and older, while Medicaid supports more than 85 million low-income individuals and families, including children, pregnant women, and people with disabilities. Eliminating these programs would immediately strip these populations of their primary source of healthcare coverage. The result would be catastrophic. For many elderly citizens living on fixed incomes, private health insurance premiums would be unaffordable, leading to a surge in uninsured seniors, many of whom would forego essential treatments, medications, and regular checkups. Preventable diseases would spiral out of control, chronic conditions would worsen, and emergency room visits would spike, placing enormous strain on hospitals. Meanwhile, for the low-income families covered under Medicaid, the outcome would be equally grim. Millions of children would lose access to routine pediatric care, vaccinations, and critical developmental services. Pregnant women would be at higher risk of complications without prenatal and postnatal support. People with disabilities, who often depend on Medicaid for long-term services like in-home care and assisted living, would be left vulnerable. Without these services, many would be institutionalized or suffer without care, an outcome that contradicts decades of advocacy for inclusive and community-based healthcare. Financial chaos would ensue as out-of-pocket healthcare costs skyrocket. The U.S. already has one of the highest healthcare expenditures per capita in the world, and without public insurance programs to buffer these expenses, individuals would be forced to shoulder more of the burden. Medical bankruptcies, which are already alarmingly common, would become an epidemic. Middle-class families could see their life savings drained to cover surgeries, hospital stays, and long-term care. The health insurance market would be thrown into disarray. As demand for private insurance spikes, premiums would soar, and many Americans would find themselves priced out of coverage altogether. Hospitals and clinics, especially those in rural or underserved areas, would face an existential crisis. A significant portion of their revenue comes from Medicare and Medicaid reimbursements. Without these funds, many facilities would be forced to cut services, lay off staff, or shut down entirely. Rural hospitals, already operating on razor-thin margins, would be hit hardest. The loss of a local hospital can be devastating for small communities, not only for healthcare access but also for employment and the local economy. The healthcare workforce would also be significantly impacted. Nurses, aides, therapists, and administrative workers would face mass layoffs, contributing to a nationwide unemployment surge. Beyond healthcare, the societal implications of such a drastic move would be staggering. Health is intrinsically linked to productivity. Without access to basic care, more individuals would fall ill, miss work, and ultimately contribute less to the economy. Employers would grapple with higher absenteeism, reduced productivity, and increased pressure to offer costly private insurance plans to their workers. Education systems could suffer as well, with children dealing with untreated health issues that affect their learning and development. Public health would deteriorate, and preventable outbreaks of disease could become more common due to a lack of vaccinations and routine care. Politically, the elimination of Medicare and Medicaid would be explosive. These programs are among the most popular and deeply entrenched aspects of American life. Their removal would likely lead to mass protests, fierce legislative battles, and political upheaval. Seniors in particular are a powerful voting bloc. A move that so directly harms their interests could shift entire election outcomes. Trust in government institutions would erode as citizens feel abandoned and betrayed by a system that had long promised to protect their health and dignity in old age or times of need. Internationally, such a move would tarnish America's image as a leader among developed nations. Most industrialized countries have some form of universal healthcare or extensive social insurance programs. The U.S., already an outlier for its high cost and lack of coverage, would further isolate itself from global health standards. Human rights organizations would decry the decision, and America's soft power, its influence through cultural and moral leadership, would diminish on the world stage. Economically, the ripple effects would be profound. Healthcare spending represents nearly 1/5 of the U.S. GDP. Medicare and Medicaid are critical levers that help control costs through negotiated pricing and bulk purchasing. Their elimination would shift pricing power entirely to private insurers and pharmaceutical companies. Without these controls, drug prices, hospital charges, and physician fees would spiral upward. Inflation in the healthcare sector could trigger broader economic instability, reducing disposable income and consumption in other sectors. Ironically, the government might not even save much money in the long run. While cutting Medicare and Medicaid would slash direct spending, it would increase indirect costs. Emergency room visits, untreated chronic conditions, and public health crises are all significantly more expensive than preventative care. States would likely bear the brunt of the fallout, as they attempt to fill the void with limited budgets and fewer resources. The federal government would still be drawn into crisis responses, disaster relief, and other reactive measures, potentially spending billions more in the long term. There would also be long-lasting impacts on innovation in the healthcare industry. Medicare and Medicaid have played a critical role in driving advancements in healthcare technology, policy, and delivery. Their data sets inform research, and their guidelines often set industry standards. Without these programs, innovation would likely become more profit-driven and less equitable, with fewer incentives to develop treatments for rare or low-margin conditions. The emphasis would shift away from public health priorities toward more lucrative markets, exacerbating existing inequalities in access to cutting-edge care. The psychological toll cannot be overlooked either. Americans would live with greater anxiety and fear over their health. Families would be forced to make heartbreaking decisions between paying for care and other essentials. The idea of the American dream, working hard for a better future, would feel increasingly out of reach if basic healthcare is no longer guaranteed in one's later years or times of vulnerability. The social contract would be fractured, breeding distrust, resentment, and instability across communities. Alternative solutions might emerge in response to the crisis, such as new state-based programs, cooperative insurance models, or expanded employer coverage. But these would take time, and not all states would have the capacity or political will to act. The disparity between states would widen dramatically. Wealthier, more progressive states might manage to establish replacement systems, while poorer conservative states could experience a complete collapse of safety nets. This would create a patchwork of healthcare access across the country, further dividing Americans by geography, income, and ideology. The legal system would also become entangled in a flurry of lawsuits and challenges. Advocacy groups, healthcare organizations, and individuals would mount legal resistance, citing everything from constitutional protections to violations of the Americans with Disabilities Act. The courts would be overwhelmed, and legal uncertainty would further disrupt the healthcare industry. Insurance companies might hesitate to expand coverage or invest in new plans amidst the turmoil, leading to a stagnant, risk-averse market. In the long run, the elimination of Medicare and Medicaid might push the nation to a breaking point, forcing a reckoning with its healthcare philosophy. It could lead to the rise of new political movements, advocating for universal healthcare or constitutional amendments, guaranteeing health as a basic right. Alternatively, it could lead to an entrenchment of inequality, where only the wealthy have access to quality care, and the rest are left to fend for themselves. Either path would mark a dramatic departure from the country's post-war consensus on the importance of protecting the vulnerable. Ultimately, Medicare and Medicaid are not just government programs. They are moral compasses. They reflect a collective belief that society has a responsibility to care for its most vulnerable members. Their elimination would not just change the healthcare system, It would redefine the values and priorities of the United States. The question would no longer be just about cost or policy. It would be about what kind of country Americans want to live in, and whether they are willing to let millions suffer in the name of fiscal austerity or ideological purity. To envision a future without Medicare and Medicaid is to confront the fragility of modern American life. It is to imagine a society stripped of empathy and solidarity, where illness becomes a luxury and survival depends on one's bank account. It is a warning of what can happen when economic theory is divorced from human reality. In the end, the decision to preserve or eliminate these programs is not merely administrative, it is existential. And the consequences will echo far beyond the realm of healthcare, shaping the nation's identity for generations to come.